A stroke is when blood vessels leading to and within the brain are either blocked by a clot or burst. And when that happens, the brain doesn't get the blood or oxygen that it needs, and brain cells begin to die. We'll keep saying time is brain. Okay, we want to get that treatment quickly and recognize those symptoms. Hi, I'm Sabrina Vega, the stroke coordinator at Mosaic Life Care St. Joe.
Hi, I'm Vicki Hardy. I am the stroke coordinator at Mosaic Medical Center, Albany.
Hi, I'm Lori Force, and I'm the stroke coordinator at Mosaic Medical Center, Maryville.
You were talking about signs and symptoms of stroke education. Should we discuss kind of what those are?
Yeah. People can have a sudden onset of dizziness, sudden severe headache.
We teach the Be Fast criteria to staff and the community. And what we want them to recognize is onset of balance issues, sudden onset of balance issues, vision changes or eyesight for the E, for face or the F, the facial droop, A, arm weakness or leg weakness, S for slurred speech, and T, time to call 911.
Yep, and that on piggybacking on the slurred speech, that could be even having difficulty coming up with words, or they're saying a word salad that doesn't really make any sense. So those are some things that if somebody's just not making sense, that could be a sign of a stroke too when they're talking.
And if you're not thinking of Be Fast, you're like, what, like in the community, what should, if they think I had a sudden onset of, maybe think stroke. It might be more than just that Be Fast criteria. Like Lori said, like sudden onset of headache, sudden onset of dizziness, sudden change in mental status. Like, think you need to get to the hospital and get that checked out.
And it is always best that they call 911 too, instead of trying to come by a private car.
Because the 911 also gives us the heads up that they're coming and gets us more prepared and ready for that individual to show up and get those tests performed and things going.
Yes. Because one of the most important tests is to get a CAT scan of their head to make sure that they don't have a bleed. And so we want to make sure that our CAT scan machine is available and ready to go.
And in St. Joe, one of the things we really push is if they're in their window for treatment, that when EMS calls, a lot of times we can go directly to CAT scan and bypass the emergency room because we'll say time is brain and we'll go over that I think a little bit later, but the quicker we can get that head CT done, the quicker we can get them treatment.
Yes, yes. Some ways to prevent from having risk factors that you can control mainly is a healthy lifestyle, which can include keeping your blood pressure within its normal limits, cholesterol levels being good, diabetes with their blood sugars,
Smoking.
yep, and alcohol consumption, any of those things that kind of put a risk to your overall health.
And your physical activity, try not to live a sedentary lifestyle at all times. But then there's some things that they can't control. And that can be just their age, race, gender, family history,
And the fact they've already had a stroke.
and the fact that they've had a stroke. Yes.
Yep.
Did you know that 80% of strokes can be prevented?
80%, really.
And just from controlling those risk factors, which is why going to your primary care doctor is so important for those wellness visits, because if they can catch some of the contributing factors ahead of time, they might be able to prevent a stroke in the future.
And taking their medications as prescribed, like on a daily basis or timely manner. That always helps too, to help with like diabetes and cholesterol.
I really want people to be aware that when they're having the mildest symptoms, it's okay to come to the ER and be seen. Don't think that it'll go away in a few hours. Just come get it checked out. We can do the test. We can do anything that we need to do and actually give you that reassurance that either you're okay or yeah, something's going on and you did a great job by coming in early.
Yeah. And I just want people to know that there is life and hope after stroke. Rehabilitation is a big key in that. It can build strength. It can help capability and confidence with the stroke patients. And also a big factor is time is brain. The sooner you get to us, the sooner we can save your brain.
We meet with stroke survivors every month, and I think that that's important to know that we do have a group available. So if somebody has suffered a stroke, that we do meet once a month, and would encourage anybody that's had a stroke to reach out to us and let us know. We would love to have them. But life does go on. But from a stroke survivor standpoint, and after talking with them, one thing they want people to know is I may look fine and I may act fine, but I don't feel fine. Their memory is not the same as it used to be a lot of times. They don't comprehend as much. So my biggest takeaway is to kind of give them grace and understand that even though they look and maybe sound fine, they may not feel fine.
So, just a little bit about, we always say time is brain. So, what does that really mean? 1 minute saved equals 1.8 days of a healthy living, and 15 minutes saved is one whole month of healthy living. So, we say save a minute, save a day.
Yep. And to piggyback on top of that, so for every 1 minute the brain is going without the proper blood flow, 1.9 million brain cells are dying. So the quicker we can offer treatment, think of all of those brain cells we're saving.
Remember, be fast.